Okay, go ahead and introduce yourself. Stand here and introduce yourself, and then I'll share the screen after that. No, right here. You have to
Okay,
stand. There you are.
Okay.
Okay.
Hi, everyone. Thank you so much for coming. I see some of my colleagues, some of my friends. Thanks to everyone who came out in support. And thank you for those who are watching online. As many of you know, I'm an assistant professor at the University of Rochester in obstetrics and gynecology. And I got interested in the climate crisis when my twins were born. One of my twins is here. Shout out. Thank you for coming. In 2008, and her birthday is tomorrow. So whatever you do, do not wish her happy birthday. That would mortify her. But I just started, like probably a lot of people, reading Elizabeth Colbert and Bill McKibben in the New Yorker, and then just kind of picked up steam over the years as the crisis picked up as well. And then I started to look at how the climate crisis was going to intersect with maternal health, which is my line of work. I take care of pregnant ladies. So most of this talk will be addressing how the climate crisis intersects with maternal health. And I'm going to approach it in a way that you may not have thought about it before, which is, of course, I'm going to talk about the external forces of climate change, but I'm also going to talk about how fossil fuels are influencing our bodies from the inside. So in a way, fossil fuels are influencing us in a 360-degree 3D fashion. Woo woo! So anyway, can I get started?
To make sure that people on Zoom can see the screen. Share this one. Okay, and then you all have to be able to see. Tell me on Zoom, can you see her screen? Can someone unmute and tell me if you can see her screen?
Or not, or thumbs up?
Yes, we can see.
Thank you. Okay. Make this
I'm like
big.
the Target lady, you know, what's her name? Kristen Wiig.
Okay. All right, we're gonna start.
Okay, but let's do it in view slideshow. There we go. Okay, perfect.
Sitting here, so
So I found it interesting when I started looking at this because we in healthcare obviously abide by the edict, first do no harm. And yet our very industry, healthcare, contributes 10% of all US greenhouse gas emissions. So aviation is 4%. And how many of you in here have thought or heard about sustainable aviation fuel? Probably a lot of people have. Probably people have heard about the flight a couple weeks ago that went across the Atlantic
Jane,
on vegetable oil.
You're talking to this people too.
Okay, on vegetable oil. So how many have heard about what healthcare is doing to help decarbonize? I'll raise my hand, and only halfway, because I've barely heard about it. People don't talk about what we in healthcare are doing, harming our patients and the communities by the practices that we have. So we actually need to take a break and think about how we can change our industry so that we're not contributing 10% of all US greenhouse gas emissions. So a major cost of not being accounted for in discussions of oil, gas, and plastics is our health. I couldn't not bring Sabine forward. I just watched this video last night. Raise your hand if you've heard of her. She's a German scientist, and she's got hundreds and hundreds of thousands of views on YouTube. Anyway, she has a new video that just popped 2 days ago where she talks about the hot models, which are I think of as hot pockets, but these hot models are basically that the IPCC has potentially used models that have underestimated the degree of change that we're going to see. And for those who were following the data last summer and saw that the ocean surface temperatures were 6 standard deviations above the mean, which if you think about that, here's a way that I think about it. There are 8 billion people on the planet right now. 6 standard deviations would be the equivalent of 3 people out of those 8 billion people having an IQ of 160 or greater. So basically, it's completely off the chart anomalous that the ocean surface temperatures are 6 degrees 6 standard deviations above the norm. And we saw that with the temperatures last year, with 2023 being the hottest temperatures ever recorded in 125,000 years. So we are off the norm. We have entered into a new climate. And her video, I encourage you to take a look. She basically kind of goes through what that means. What does it mean if we've been using the wrong IPCC models to predict what's going to happen in 5, 10, and 20 years? She's a very good science communicator, so take a listen. I found this study that came out last week, actually January 11th, showing that plastic chemicals were linked to over $250 billion in US healthcare costs in 2018 alone. So you'll see I put some other statistics up there. Fossil fuel pollution costs the US $820 billion in healthcare costs. Wildfires, increase in vector diseases, so mosquito-borne illnesses, et cetera. So we are paying for the damage that fossil fuels are doing to our health and our planet. As you can see, I already mentioned, we are likely past the 1.2 average. We might be slightly under it in 2024, but many are saying that 1.5 is done. We're beyond 1.5 and likely will pass up to 2 degrees centigrade in the 2030s unless we take action. So women and girls are more affected by the climate crisis. A meta-analysis, meaning a survey of 130 studies, showed that 68% of them had indications that women and girls were more affected by the crisis. They're more likely to die in heat waves, and unfortunately, they're also more likely to die at the hand of their partner, as a heat wave in Madrid saw a 40% increase in the risk of femicide after that heat wave. They're less likely to get food, and they're more likely to experience physical and sexual violence. So this graph basically shows a couple of different categories comparing in these 130 studies how women and men were different in how they were affected by climate effects on health. So in terms of food insecurity, mental illness, reproductive health care outcomes, and death and injury from extreme weather, women and girls were more susceptible. I put this up there because I just think it's the best graphic ever. But what you'll see on the left-hand side are effects of the climate crisis, warming, precipitation, floods, droughts, storms, etc. And then looking on the right as to how those are related to different increases in viruses, bacteria, fungi, etc., etc. But let's just face it, it's a cool graphic. So bottom line, women, girls, and pregnant women are more vulnerable to the climate crisis. Let's talk a little bit about pregnancy and heat. Now, obviously, we're here in upstate New York, so we're slightly protected. We're not like the folks who were living in Phoenix, where if they fell on the ground, where the temperature on the ground was 170 degrees, they were getting 2nd and 3rd degree burns just from touching the pavement. But pregnant women are more susceptible to heat. I love this book by Jeff Goodell. He's a reporter for Rolling Stone, but this book is really, really great. It's really easy to read. But basically, pregnant women have increased oxygen consumption. Their heart rate and cardiac output are increased in pregnancy. Their metabolism goes up, and they have increased heat from the fetus and the placenta that are growing inside them, and that makes them more susceptible to heat changes and heat waves. This is especially true for our farm workers. So something to think about. Right now, the US does not have any laws protecting our pregnant farm workers or any of our farm workers in terms of heat and heat-related illnesses. What we found in studies is that heat exposure increases the risk for preterm birth, low birth weight, and stillbirth in over 70 studies. So very, very strong signal, very strong data there. In addition, dehydration makes your blood a little bit thicker, increases your risk for cardiovascular disease and events like a blood clot. For every 1.8 Fahrenheit rise, there's a 5% rise in stillbirth and preterm birth, and for every 10 degrees, an 8% rise. So pregnant women, the CDC says, are more likely to get heat exhaustion, heat stroke, and heat-related illnesses, and sooner than non-pregnant women. So I wanted to talk a little bit about a wet bulb temperature. So wet bulb temperature is basically when you combine the temperature of the temperature outside with the humidity. And, you know, we talk about that usually as like a heat index. But when we talk about wet bulb temperature, that heat index actually can reach levels where humans cannot survive any longer. So you'll see on the graph on the lower left-hand side, basically, as the temperature rises, you can only have a certain amount of humidity before your organs will shut down. And the reason they'll shut down is because you can't evaporate, you can't sweat anymore. Basically, the ability of your body to cool down stops. And they say around 6 hours, once you reach that wet bulb temperature, until people die. And people have died from wet bulb temperatures, specifically recorded in Pakistan and some other areas that are more susceptible to that combination of heat and humidity. Here in the US, we will see this in places like Mississippi, Louisiana, Florida, Texas, where we have those really high heats combined with the humidity. And there's a nice little graphic there showing heat loss through evaporation. So something to think about here in Rochester, we have seen across the US, but in Rochester as well, that there are different temperatures in a given city depending on the neighborhood that you live in. And this has a lot to do with systemic racism and the practice of redlining that occurred back in the 40s and 50s. So basically what you find are these urban heat islands, places where there's a higher concentration of asphalt, fewer trees. And so the actual temperature in the same city can be up to 20 degrees different depending on where you are in that city. And we saw this when I lived in Los Angeles, especially, that some neighborhoods had a 20 degrees different compared to a shady suburban neighborhood. So this is an issue of equity, and it's an issue that we as a society obviously have to address, because by 2050, over 2 billion people will be exposed to deathly heat in the US. And as this article says at the bottom, more than 40 million people in the US live on urban heat islands. And I actually lived in a part of LA that did not have a lot of trees and was actually very, very hot. And that's one of the reasons I left. So I think these studies connecting sea level rise and blood pressure are fascinating. So basically what we're seeing is that as sea level rises, the salinity, the high salinity of sea water gets into the water table. And then women in pregnancy, studies have been done, will drink the water coming from their tap, but it has a higher amount of salt water in it. And so when we see that, the studies that I read have been done for the most part in Bangladesh, where the seawater has infiltrated the water table. So these women were coming down with higher rates of high blood pressure in pregnancy and higher rates of preeclampsia in pregnancy. And so this will begin to happen probably on the US shores shortly, as we saw in New Orleans last October. So you might remember that we were really worried about the water table in New Orleans because of the drought and the heat. The seawater was making its way towards New Orleans, and it was expected to enter the levees or breach the levees around October 28th. They were able to stave it off, but had the seawater been able to infiltrate the water tables in New Orleans, we would have begun to see some of those high blood pressure related illnesses, not only in pregnant women, but in other people due to the infiltration of salt water into that water table. So you might have heard that there are more cases of malaria, malaria native to the US, not people that got malaria elsewhere and traveled back to the US, because we are seeing an increase in US transmission of malaria by 39%. In addition, we're seeing increased dengue virus, and my sister got dengue, and I mean, that is a really, really, that is a tough illness. I've heard other people that have gotten dengue. Maybe Valerie, you know some people, but I mean, it's so painful. Yeah. So the R naught of the dengue, meaning its ability to be transmitted, is now greater than 1. in the US. So that's not going to be good. And then actually here on Long Island, those of us in the medical community saw that the CDC or someone put out a bulletin that we were seeing increased rates of Vibrio transmission on the Long Island coastline. So these are diseases that are going to be moving north as the temperature warms. So this was super fascinating. I did not know this, but 42% of US petrochemicals are manufactured or refined in the Houston area, the greater Houston area. And so what this study did was it looked at women who were pregnant during Hurricane Harvey, and it looked at their neonatal and maternal outcomes based on how far they lived from one of these petrochemical manufacturing facilities. And what they found was that women who lived the closest to these facilities during the hurricane, where, of course, the petrochemicals leached into the water table due to the hurricane, that their morbidity in pregnancy increased by market amount. So neonatal morbidity increased by 50%. So these are babies born with adverse outcomes due to their mother's contact with petrochemicals that had leached into the water table due to the hurricane. So I don't know. I wouldn't live in Houston. All that petrochemical manufacturing. This was a great meta-analysis that was done in the Journal of the American Medical Association. They looked at 32 million births, a huge, huge meta-analysis, 68 studies. And what they found was that when women were exposed in pregnancy to fossil fuel air pollution, that they had increased risk of low birth weight and preterm birth. Those with asthma were more affected, and minority and Black mothers were also more likely to be affected. We know globally somewhere between 8 and 10 million people die every year due to fossil fuel air pollution, and those numbers are only increasing. We do know that air pollution plays a role in fertility. In the US now, we see 1 in 6 couples struggling with fertility, and air pollution might be playing a role. These studies show that the closer that you live to a major roadway, the more likely you are to experience infertility. Having moved here from California, and obviously as New Yorkers got to experience last summer, wildfire smoke is very dangerous for all adults and children, especially those who might have comorbidities, who might have other health conditions like asthma. But pregnant women exposed to wildfire smoke for only 1 day faced a higher risk of giving birth preterm. So in summary, heat, air pollution, wildfires, hurricanes, flooding, fracking, all put pregnant women at increased risk. So now let's turn our focus, like I said we were going to do, and we're going to look at what these petrochemicals are doing to the inside. So FACOG is the Federation of the International Organization of Gynecologists and Obstetricians. And they said every pregnant woman in the US has at least 43 different environmental chemicals in her body. And to a disturbing extent, our babies are being born pre-polluted. So this was a study done in the US and Puerto Rico, and they were looking at 171 pregnancies, and they found 90 to 100% of pregnant women tested positive in their blood for insecticides, parabens, phthalates, and those are the types of places and products that women would be exposed to those chemicals. So basically proving what the National Cancer Institute said about our babies being born pre-polluted. So the big endocrine disruptors, these are fossil fuel derived byproducts, are BPA, phthalates, and parabens. And you'll see there some of the associations that each of them have. They act like hormones in our body, or they mimic hormones. And so that's why we call them endocrine disruptors, because they can affect our thyroid, they can affect our estrogen. They basically can mimic the hormones that we already have and cause chromosomal problems, cancer, polycystic ovarian syndrome, insulin resistance, diabetes, etc. So interestingly enough, half of all plastics ever made have been made in the last 13 years. Scientists have been measuring BPA in the urine, and now are finding it 44 times higher than previous levels. And importantly, the federal government and the agencies and bodies that we depend on to help regulate these chemicals haven't been updated since the 1950s. So phthalates are a huge one. Phthalates basically make our plastics soft and pliable. If you have a plastic cup, it could have some phthalates in it, but anything that is soft and pliable has phthalates in it to make it soft. Importantly, ExxonMobil is the largest producer of phthalates, and 12% of all global oil is made into plastics. And you'd better believe when the big oil companies knew that there might come a day when we would decarbonize and electrify, that they are planning on us being addicted to plastics until the end of time, and actually have made huge investments in plastic manufacturing and factories across the globe. So prenatal phthalate exposure, obviously, as I mentioned, it acts like a hormone in our body. It increases rates of obesity, preterm birth, high blood pressure, diabetes, infertility, miscarriage, and prenatal exposure leads to an increased risk for childhood obesity. So this was a fascinating study. What they did was they measured phthalates in fast food. And those are some of the fast foods that they tested. And interestingly enough, back, I forget the year, in the 1990s, they banned, or maybe it was the early 2000s, they banned phthalates in the Happy Meal toy because they knew that the phthalates in the toy, would likely go potentially in a child's mouth. And so they didn't want the child to be exposed to the phthalates in the toy, but yet the phthalates are still in the food. So there was a little miss there. So meats in these studies had the highest concentrations of phthalates, and cheese pizza had the lowest. And this is an important equity issue as well, because Black people in the US report greater fast food consumption than other racial and ethnic groups. Therefore, they face a higher risk of exposure to these chemicals. And as an obstetrician, we're always looking at this data showing the racial disparity for women in Black women in pregnancy, higher comorbidities and higher death rates. And I would argue that I do think that there are environmental components to those statistics that we see that make us angry and break our hearts. So phthalates have been shown to decrease fertility as well. As I mentioned, 1 in 6 couples in the US now struggles with fertility. So this was a recent study. This was just published a couple of weeks ago, looking at 1,200 women. And what they found that high phthalate levels were associated with inflammation and oxidative stress. They caused a woman to experience low estrogen and high FSH. A woman who has a high FSH is approaching menopause or has entered menopause. So in this way, the phthalates were directly causing problems with fertility. So in summary, phthalates are harmful to women's health, fertility, pregnancy, infants, and children, and Exxon is the largest producer of these. Let's talk for a second about forever chemicals. You've probably heard these on the news. These are these long chain carbon molecules that have some fluorine in them as well, some fluoride atoms. And these were manufactured they were discovered in the 1940s. And what they do is they basically wick moisture. They're a barrier. And the reason they're called forever chemicals is because they have no idea when these might break down. It could be thousands of years. So these are lining our microwave popcorn bags, our pizza boxes, all the things that we get our takeout food from, our water bottles, our nonstick cookware. You've probably heard of that. Our cleaning products, and then anything, if you've got that 3M thing that you spray your furniture with to keep stains away, that's all PFAS. Unfortunately, these chemicals are deleterious, and unfortunately, they've known about it for a long time, and they didn't tell us. So in the 1950s, 3M and DuPont, who were the major manufacturers of PFAS, knew that it could pollute people's blood and cause significant health consequences. If you've ever seen that movie with Mark Ruffalo, Dark Waters, it's about a PFAS manufacturing plant and how it impacted the community in which they were spilling their, their PFAS into the local water. Anyway, I didn't know this, but the chemical industry is 21% of US GDP. So these are billion dollar entities. In 2023, so just last year, the EPA determined there is no safe level of PFAS. 24 states have banned the chemical. In 2021, the House tried to pass a law to allow us to measure it, to regulate it, and to hopefully, obviously, ban it, but it failed in the Senate. So currently, we do not have a federal ban, but we do have state bans on the use of PFAS. Unfortunately, PFASs do affect fertility. This was a study published just a little over a year ago. And what they found was that women who had high levels of PFAS in their blood had a lower chance of becoming pregnant in the year. And also that 99% of the US population has PFAS in our blood. So that means probably almost all of us in this room. PFAS has also been linked to polycystic ovarian syndrome. It's been detected in cord blood, placenta, and breast milk. And the US EPA has proposed some standards. This was another study published in May of last year. You'll notice that all my studies are pretty recent, right? We're just learning about these things. 302 pregnant participants, 97% of the women studied had blood that was positive for PFAS, increasing risk for diabetes, high blood pressure, and low birth weight. And then this came out in September of last year, showing PFAS was associated with melanoma, uterine, and ovarian cancers. So this is a cool website with environmental working group. You can basically go to your area of the country and determine what the PFAS levels might be in your area. And as you can see, we actually don't have one of those circles next to where we are. And in fact, the water here is pretty good. I even heard Evan Dawson say so when he did a PFAS connections a couple of weeks ago. But you'll see down along the eastern seaboard, Massachusetts, New Hampshire, that area, they have really high levels of PFAS. So if you ever want to know what your level is, you can use this environmental working group site. So in healthcare, we use a lot of phthalates, right? Because every single piece of tubing, all our catheters, all our blood bags, our breast pumps, all our gloves, they all have phthalates in them. So PFAS and forever chemicals are harmful to women's health and pregnancy, and they're still being manufactured. If you hear that a cookware, for instance, doesn't have PFAS in it, I've gone down the rabbit hole, and they basically have manufactured other types of chemicals that are not called that, but they function in exactly the same way. It's just that the molecule hasn't been tested and proven to be deleterious. So as Brooklyn can attest, we are now trying to move over to stainless steel only. Let's talk a little bit about plastics, as in, bigger plastics. It takes 450 years for a plastic bottle to degrade, and bottled water requires up to 2,000 times the energy used to produce tap water as compared to regular tap water. So you might have seen this study just came out last week, showing that these researchers sampled water from 3 different major manufacturers of bottled water and found up to 250,000 nanoparticles in each bottle. So this plastic that is in the plastic water bottles is PET, or polyethylene terephthalate. So nanoplastics are plastics that are 1/1,000,000th of a meter. Basically, we all are drinking these all the time. So good luck. Now, if I have one piece of advice, if I have one thing to take home tonight, it's this: do not put plastics in the microwave. In 3 minutes, a plastic container, a Tupperware in the microwave, releases 422 million. That other slide was 250,000. This is 422 million microplastic particles in 3 minutes. So glass every day, all the time. If you see your friends doing it, tell them. If you know someone who has a baby, consider glass for formula, or if you're using a bottle for breast milk. There was a study, they took kidney cells and they bathed them in concentrated plastic, and 76% of the cells died within 2 days. So microplastic exposure can cause some serious human harm. This was just published a couple of months ago, showing that the US beverage industry, so again, like when I mean, those of us who are older in the room can remember when there were vending machines that had the bottles in them, and then you'd get a bottle and the rest of the bottles would go clink, 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 clink. It's kind of satisfying, that sound, when I think about it. But we don't have glass bottles in our vending machines anymore. We have plastic. 1 million plastic bottles are produced every minute, and 70% are never recycled. Unfortunately, it's not just the plastics in the bottle, it's the 8,000 to 10,000 chemicals that are added to the plastics that the manufacturers don't have to tell us what those chemicals are that are in the plastic bottles. So there's a lot of gray, a lot of undisclosed information about all the chemicals that are in those plastics. So microplastics are plastics that are 5 millimeters or less. Again, they cause damage to your immune system, oxidative stress, and energy and fatty acid metabolism. That's how they create problems with obesity. Exposure to microplastics increases, as I said, obesity, high blood pressure, cancer, reproductive health harm. So this was a study where they looked at an infant compared to an adult, and they took their feces, and what they found was that the baby had 20 times more higher concentration of plastics in its feces than the adult did. So our babies and our babies in utero actually are getting exposed to plastics from the start, from the beginning. Microplastics, unfortunately, they do cross the blood-brain barrier, so there is some thinking that they can be related to dementia. They are now being found in heart and lungs for the first time, so basically in every organ in your body. And so these two charts I thought were fascinating because on the left, what you'll see is sperm count decline. So as you probably heard, sperm counts have plummeted over 50%. And then on the right-hand side is chronic disease burden. So that's cardiovascular disease, cancer, digestive diseases, et cetera. There was a study that just came out showing increased rates of cancer in people under the age of 50. And with no explanation as to why. But I would argue, as you might imagine, that it's due to some of these environmental toxins. These are some studies where they look at the placenta, and there's 3 studies on there, one of 2 placentas, one of 6, another one of 17, and all were positive for microplastics. And the types of microplastics that our babies are being exposed to in utero are polyvinyl chloride, PVC, you probably heard of that, polypropylene, which is in some of our clothing, etc. So 12% of all global oil is made into plastics. Big oil wants us to be addicted to plastics because they know that we're decarbonizing, and so plastics are dangerous to all organ systems. So I actually got super fascinated by this when, you know, I've been practicing obstetrics for 20 years. And I'm telling you, when I started out, I did not see the number of women with hypertensive disorders in pregnancy like I do today. And you'll see there that pregnancy-associated high blood pressure has been increasing at 2.1% per year over 1995 to 2019. In addition, the adult obesity rate is going up, a 37% increase in 10 years, and then gestational diabetes up 27% in 5 years alone. So these are chronic diseases. These are oftentimes diseases that we think of as being associated with older Americans, not younger Americans, like 20-year-olds, you know, early 30s, women who are having babies. But I'm sure the other obstetricians in the room will agree with me when I say that something's different. It is changing. We have a lot of women who are having to undergo induction of labor early because of their pregnancy-associated high blood pressure. And cardiovascular disease and high blood pressure are one of the biggest killers of women in pregnancy, and can be one of the reasons that we see such high maternal mortality rates in the US. So these are these Norwegian or Swedish researchers, and they basically published a study where they said, you know, well, what are the safe limits for human health in a series of categories, such as land systems, fresh water, exposure to chemicals, ocean acidification, ozone depletion, et cetera. And what they found was that we've gone beyond the safe limit for human health in 6 out of 9 of those planetary boundaries. So let's talk a little bit about plastics, a little bit more, because you can tell I'm obsessed with it. So ExxonMobil, again, the largest producer of single-use plastics. The fossil fuel companies are doubling down on production, $208 billion to expand plastic production worldwide. This was last week in Consumer Reports. Do you see how late breaking this talk is? You will get this talk nowhere else. This is Consumer Reports cover last week, how to eat less plastic. So again, they said, don't drink tap water, heat food in glass. This is them saying it, not me. Heat food in glass and buy food and store it if you can in glass, silicone, or foil. Eat as much fresh food as possible. Vacuum your house regularly because lots of the microplastics are up in the air, and work in your community to help work with Color Bright and Green. That's what you need to do. I listened to a podcast, so I just wanted to tell you about this. The 3 biggest risks of getting plastic into your food are heat, acidity, and fat. There's a YouTube at the bottom if you want to watch it. It was a fascinating talk. She's an expert in plastic migration in food. This was a study showing that, again, published December. This was a study showing that, you know, we only recycle a very small amount of our plastics, but the plastics that we do recycle have a lot of things in them. 191 pesticides, 107 pharmaceuticals, 491 plastic chemicals found in these recycled plastic pellets. So recycling plastic, while we think recycling might be a great idea, are we sure that this is the chemical and these are the things that we want to be recycling? Because what we're seeing is that if you store pesticides in plastic and then you recycle that plastic, then those plastic pellets that get reused to make something else have that pesticide in it. So anyway, I feel like this is a Pandora's box that I wasn't aware of about the types of chemicals that are in recycled plastic. So this was published last week. They did a study showing which proteins contain the most microplastics. Breaded shrimp, #1. Who would have thunk, right? Unfortunately, my favorite plant-based nuggets are there, #2. Chicken nuggets, pollock, pink shrimp. Anyway, at the bottom was chicken breast. So what can we do? So when we talk about decarbonization, we talk about 3 different types of emissions: Scope 1, Scope 2, and Scope 3. Scope 1 emissions are the types of emissions that we in healthcare make. So you wouldn't know this, but we provide we provide nitrous on labor and delivery for women for pain management, but that nitrous that escapes goes up in the air and lives there for 114 years, and it is a powerful greenhouse gas. Desflurane, which is an anesthetic gas, has 2,540 times the impact of CO2 on greenhouse gas emissions. So hopefully URMC is not using that. I haven't bothered Michael Apostolakis with that in a long time, but I should ask him. Anyway, so Scope 1 emissions are the types of emissions that you as an organization that you emit directly into the air. Scope 2 emissions are the types of emissions for the electricity that you buy. So probably, hopefully everyone in the room knows, but you can actually tell RG&E that you want to buy 100% renewable electric, and you can bring 100% renewable electric into your home. In addition, all the businesses in New York State can do that too. You'll see all the purple states means that their electric retail choice is easily available. So if you're with a business, maybe ask your business, can we make sure that the electricity we're buying is wind and solar? Woohoo! And Scope 3 emissions. Valerie is here with me. She's an emergency medicine colleague, and we're trying to look at how many emissions are in the supply chain at URMC. And so one of the things we're looking at is the dreaded speculum here. Some women in the audience might recognize this. And we took this apart at Valerie's house, and what we found were those 2 little lithium batteries. We had no idea it was a lighted speculum. We didn't know how it was lit. Now we know. So we might use this speculum for 30 seconds and then all that plastic goes in the trash and those lithium batteries go in the trash, all for 30 seconds of use. So looking at the types of supply chains, the types of products that you purchase and bring into your business is another way to address decarbonization and how to make better choices. The operating room where I work sometimes, where Dr. Turlo works sometimes, where Dr. Sun works sometimes, is responsible for 40 to 60% of all supply costs. And scope 3 emissions, all the products that healthcare buys and brings into the hospital are 80% of all the greenhouse gas emissions for that facility. So 30% of a facility's waste comes from the operating room and 66% of that red bag waste, which is the type of waste that has to be burned or incinerated because it contains blood and other bodily fluids. So we in the operating room, we use 3 to 6 times more energy than the rest of the hospital. I thought this is the first time I've seen this, but I thought this was interesting. Scientists want to put carbon footprints on our drugs, but it's hard to get accurate numbers. In order to decarbonize the supply chain, we sort of have to know how much carbon did it take to make that thing, and then give the purchase managers the ability to say, well, I'm going to choose Joe's speculum because it has less carbon emissions than Sally's over here. But that could be done obviously with every single product and device and drug that comes into the hospital. And similarly for the business that you work at, knowing how much carbon emissions go into the things that we use in our daily life can be helpful, but we have to put a footprint on it. And I'm going to end sort of by turning the scope again and just talking about what we can do here in our community. So as you might know, 15% of all greenhouse gas emissions in the US are from animal agriculture. We eat more meat than any other country per capita on the globe, and significantly more. So going to a plant-based diet lowers your emissions, your family's emissions really significantly. Some people might have seen the new Netflix special where they take the twins and one of them eats a regular diet and one eats a vegan diet, and then they look at the health benefits, and you can imagine the health benefits of a vegetarian or vegan diet are really good. So here as the doctor, I'm telling you, I'm sure all the doctors in the room would agree, as much plant-based as you can incorporate into your diet, the better. Food waste, 15% of all of US healthcare's greenhouse gas emissions are from cafeteria food waste. So food waste is not something that we can really ignore, right? Food waste is 6% of global greenhouse gas emissions. So obviously making sure that you don't waste food, making sure that the food that you are done with, you can compost so that it doesn't go into the landfill and increase methane. Fast fashion. I know that you guys know this, but I put up some of the brands there to avoid. I mean, when I look at these statistics, 10% of all global emissions coming from fashion, 700 gallons of water to make one cotton shirt. And this has really hit home for me ever since I finished this book on plastics. 60% of all textiles are plastic. So anything that's polyester, all my jackets, like I'm looking around my closet and I'm like, oh my God, I'm surrounded by fossil fuel. Anyway, it's really devastating. It's devastating. The average American purchases 67 new pieces of clothing per year. We could do better. Brooklyn. No, she's doing good. She's doing good. But also when we return items, they don't necessarily go back for sale, right? They go 50% of our returns go to landfill. Oh my God, I just found this when I read about this, avoid the black plastic. I had a bunch of these at my house. I guess they have some toxic chemicals and heavy metals and flame retardants in them. Less plastic. I got these little toothpaste, the little bite things. They're pretty good. They work pretty well. My daughter got me some nice concentrated shampoo for Christmas. You can put a filter on your washing machine to filter out your plastics, because when you wash all of those polyester jackets and things, then all those microplastics go into the wastewater, and then they go out into the river, and then they go to the ocean, and then the fish eat them, and then we eat them when we buy the fish from the ocean. So I've also tried these laundry sheets. They work really well. I put up there, since I'm a gynecologist, some great menstrual products, you know, that are reusable, menstrual panties. But this website, My Plastic Free Life, was really good. I thought that was good. And then these are the types of products that you'll see the PFAS and PFOS in. So obviously looking, asking questions, doing some research, making sure that you're not exposed to those. And then actually the American Academy of Pediatrics has a great little section on how to reduce your family's exposure to PFAS, which I thought was great. Popcorn, you know, the microwave popcorn, whew, that's a bad one. I already showed that. Transportation, obviously, it's so great that Elmwood now has the bike lane. I'm planning on using that next summer because I live on Elmwood and it's a straight shot. You can get an energy audit for your home to determine where you might be leaking heat in the winter or cool air in the summer. And then I took a flight-free pledge with Flight Free USA. 4% of all emissions come from aviation, so it's not that much, but I'm committed to not flying. And the last and maybe most important is to vote, because if we want the Senate to pass a law saying that the EPA needs to determine how harmful these PFAS and PFOS chemicals are, we have to have politicians who care about our health. I started OBGYNs for Sustainable Future with another OBGYN. We have webinars every quarter where we talk about our field, OBGYN, and how we can decarbonize. But it's obviously it's open. Anyone can go look at our videos about how to be climate smart. And then I've published, for those who care, in the Green Journal, which is the Journal of Obstetrics and Gynecology. It's like our main journal. That came out in December. And then we had one in April of last year, Going Green in Gynecology. And I think that's everything. Yeah, that QR code will take you to join to our email list, and then you'll get updates about the webinars that we have. So the next webinar is in February, and we're interviewing Lisa Fetal. She started what's called the Medical Consortium for Climate Health. So this is gathering all of the medical specialties, surgery, peds, radiology, obstetrics and gynecology, family medicine, gathering all the medical specialties together to try and address this crisis. So that's cool, right? And then I have some announcements for Color Bright and Green. Next month is the pollinator. March is repairing and fixing instead of throwing away. So I actually have something I'm going to bring to that, because one of my mixers, 2 in March. Fix it, don't trash it. So that is March 12th. And then the pollinators, pesticides, and Parkinson's, that's Ray. Oh, that's cool. He's another physician / environmental fanatic like me. So that's cool. That's so great.
Can I stop sharing? So
Oh,
we
yeah,
can
yeah.
Get some questions.
Oh, yeah,
maybe?
questions, right.
Okay, so I'm gonna stop sharing.
Oh, look, 7:22. Go me.
Good job.
Yay, Stacy.
I can't believe it's all that outside. But my question is, like, in New York State, you said that we didn't pass that Senate. Do we have anything with the state that?
So repeat the questions.
That's a really good question. The question was, I said that 24 states have banned PFAS in their state, and has New York? And that is such a good question. I haven't been worried about it because our water looked good. So I was very selfish, and I only thought of us here in upstate. Whereas, as you can see in downstate New York, Valerie, do you know the answer?
New York State?
Yeah.
Why not? I'm not sure.
Yeah. Excellent question. I will get back to you. Other questions online, other questions. Valerie.
I really liked how we were talking about things that we have control over.
Yeah.
Our exposure and a lot of those also have impact. But how do you come to the patient who may not have the to enact some of the stuff, right? So like plastic, whatever was cheaper, like plastic was cheaper. Like, how do you cancel that patient at this for
That is such a great question, and I actually feel like I can't. Because I feel like it's a systems issue as opposed to an individual issue, and I would never want to make my patient feel like the way that they function in society is bad or wrong when it's society's responsibility to protect them. I mean, I saw one of our midwives reheating her food in her plastic the other day, and I couldn't even say anything, even though I wanted to, because I felt bad, because I felt like if I said something, it might make her feel bad. So if anyone else has a way to talk about these things without making people feel bad, I would love to know, because I'm at a loss.
I mean, I think they like being all it's your responsibility, personal choices that matter, but it's so microplastics are so prevalent, it's not. Choose all the right. She says.
Oh, yeah.
And I wonder what the role is getting involved with that. Is, you know, at least face to face, stay in your lane. And then I always want to say, it's all in my lane, you know, take it off.
Yeah. For the people that are listening, our discussion was about, you know, how do you as a physician potentially tell your patient that they need to, say, buy glass bottles instead of plastic bottles if they're feeding their infant formula, in order to limit the plastics exposure to their babies. And I think the consensus is that we don't necessarily have a way that feels equitable and grounded in justice to talk about that.
Which is why I think it's important. It's like, state.
Yeah,
We've had the state digital, national digital stand.
yeah,
Started. So like, we hear. But that's the chemical. So chemicals like PFAS, regardless of what we do.
right.
That's not about like.
Dr. Sun said that it's at a national level that we can be advocates as physicians. I think that's a really good point. Ellen?
You have the update on PFAS.
Oh, yeah.
In 2016, New York State became the first state in the nation to regulate PFOA as an active substance. It also is illegal to use PFAS in food packaging.
I was expecting, but
Correct.
I was trying to find stuff about that. It's almost.
Yeah.
Especially.
Even those cucumbers, that's the worst, those English cucumbers. We're talking about not being able to go to the grocery store and get something not wrapped in plastic.
Like. Plant-based, it's all packaged. It's all packaged.
Yeah,
Like I took it.
right.
But
Exactly.
how long is it?
Steven?
So critical statistics, and so I mean, several of them were ways of living with that. What percentage of our exposure is injuries? There's so much plastic in landfills. There's so much plastic in the ocean. It's being absorbed into the water table. It's being spread on the crops. It's being eaten by the animals, or those who eat animals. How much of it can we control? How much of it is indirect? Where even if they stopped making plastic now, there's so much of it out there without figuring out a way to eliminate it.
Right.
Which is not land, which is not recycling. I just wonder, like, if we did everything right, what do you think our exposure is still going to be? You know, there's just no controlling it. Is it like?
Stephen asks, what do we think the impact would be, and what can we control in terms of where some of these indirect exposures are? And I guess I think that we haven't studied it enough and that we're only beginning to potentially correlate the disease burden and the infertility burden as being causative from environmental toxins. You know, for sperm counts to go down that far, and Dr. Parasan, you probably have seen some infertility patients in your practice by now. You're sort of like, you are 26 years old, you have no reason to have infertility problems, and yet you and your partner are having trouble, his sperm is normal, etc. We don't have a reason for why you are having fertility problems. And so that disease burden, as you saw from those graphs, are going up globally, right? And I would say that, to answer your question, we actually don't know, because the fact of the matter is that I, at 55, probably have less of a plastic burden in terms of my lifetime exposure than children who are than my daughter's age even, right? Because she's been exposed to more plastic than I ever was. So I do think that it's something where we actually don't know. We don't know what the burden is. And to your point, like, what if we did everything right? How much of it is sitting and going through the water cycle process, right? Because we found these plastics on Mount Everest, and we found them in the Mariana Trench at 26,000 feet below. So the question, I think, is a great one, and we are in what some people have called the Plasticine. Like, that is life on Earth now, is plastic, full of plastic.
It's really interesting because I don't think we can get rid of plastic in our lifetime. And I think it is interesting to do more research on how it affects health, but I think the bottom line is that they not know that it turns us to turn off the spigot. You know, like, yes, there are plastics that are there. We know that some of it is related. We just have to turn off, you know, if your top is flooding, so you would turn off the spigot, right? Some of those numbers do go up, but we do know that hotter has worse. So stop having for.
Right, well, like the hospitals used to have metal equipment, they would auto.
Yeah.
I think maybe there's a reason from the infections. So now we move to all these perishable plastics. There's like this profit margin thing.
Absolutely.
That's one of the new projects, right? Propaganda. They think it's more cost effective.
But so we're talking about plastics and how to measure the harm. Dr. Liu and I went to the manufacturer of the plastic speculum, because the manufacturer's website will say that it's cheaper to use plastic. But what we noticed is they only include the cost of production, not the cost of disposal, and obviously not the human healthcare costs either, because nobody was getting sick from plastic pollution when we autoclaved. And in fact, for the speculum, the carbon emissions for the metal are 1/5 of those for the plastic. So yes, exactly. I know, right? Wasn't it like? Yeah. So there's a question online, and they ask, silicone has been found as safe alternative to plastics. And do you know if silicone is really a safe alternative? I did look into this, and for the most part, I use silicone, you know, the spatula, Dr. Stevens gave me a silicone spatula for Christmas. And Brooklyn used it to make eggs this morning. So yeah, I've been using silicone. Do other people have comments about silicone? Yeah. Yeah.
But the nipple is still plastic.
Yeah.
You know, it's just like, I remember all this. When the breast pump stuff, that's all plastic.
Yeah.
I can't buy it, that's not plastic.
Yeah. Yeah.
So, alternatives. Okay, love with water that I don't. One of those things, you're like, you do everything you can, but you don't know until it's that much better. Yeah,
That's true.
Lots of water, it's much safer and but I dread the day of cleaning it out. Stop sitting.
Yeah.
Are there any hospitals or is the country on the 37?
Yes, Rochester Regional is doing a much better job, actually. So our organization, OBGYNs for Sustainable Future, is part of Healthcare Without Harm, which is a global organization to address, and it's not just physicians, it's everyone in healthcare, nurses, other people that are activists in this area. And so Healthcare Without Harm has a for-profit arm called Practice Green Health. And what they do is they will go into a hospital and do an audit and help a hospital to decrease their emissions and to have more climate-friendly policies. And Rochester Regional gets awards for their climate initiatives. Like the fact that these two organizations, URMC and Rochester Regional, are in the same city and yet doing so markedly different on this topic is mind-blowing. Unfortunately, I work for the latter.
I also want to
Well, I mean, I go into Michael Apostolakis's office with a list of ideas, and I send him my articles, and we have a new CEO. Maybe he will be open to ideas. But our cafeteria is a nightmare in terms of plant-based food. Plant-based options for patients are pretty much non-existent. We have at URMC, we have recycling bins. And I talked to the man who's manages all the trash for URMC. Nothing in the bins gets recycled. It's a joke. It's a joke. Yeah. So, yeah. Yeah.
also, like,
Yeah.
plastic flyers, yeah,
No,
like, it's only glass.
exactly.
Like, buying plastic. Yes. Yeah, yeah. Well, they ship them off to China. China's not like that.
But should we be recycling the plastic? I think that's a good question, because these plastic pellets that are getting recycled are full of all sorts of terrible things. Well, to Valerie's point, we should stop. We should stop it at the spigot. Oh, I know. I know. It's hard.
I just don't know what our gauge is doing, that's like fantastic too, because like I would love to, it's been done before.
They have like a solar array, so they get a lot of their power from solar. They have a ton of EV chargers. I also have talked to the parking manager at URMC being like, there are 2 chargers for 800 cars, and the parking garage has 2 chargers, and they're like, bleh. So they have chargers, they have addressed their cafeteria, they've addressed the supply chain. The supply chain is the hardest part. But you can choose certain products, like you can choose an asthma inhaler that uses an MDI, which actually contributes a lot of greenhouse gas, versus there are other methods, I forget what they are, to deliver albuterol in an inhaler that don't emit greenhouse gases directly from the MDI. So there's lots of choices that can be made. Dr. Parasam. I'm going to be prepared for the apocalypse. Yeah, I mean, I feel like sometimes I listen to so many podcasts and I read so many books, my daughter can attest. Like, I mean, you begin to feel like a conspiracy theorist, right? Because you're like, what the hell? Our babies are being born with plastic before they've even come out of the womb? Like, that is so not okay. And, it feels like an existential crisis that we've allowed a society to get to this point. And I guess, I compartmentalize it a lot. Although, as my daughter found on the internet the other day, someone did give me a review on health grades that said that I said that children are bad for the environment, LOL.
In Europe, that processed food is the most expensive.
Yeah,
So that's how they. How it's processed. But then in Europe, it's the most expensive, and Russia,
yeah.
we have the total opposite.
Totally. Here's one thing I do. This is one way that I do incorporate it into my practice. And that is that if I have the time, I will sit down with someone and tell them that it's possible that their inability to lose weight, their high blood pressure, their diabetes, it's not all under their control, because I do think that a lot of our patients feel bad that they have these complications of their pregnancy. And while I don't have time to go into a lecture like this, I know in my heart that those marked rises in obesity and high blood pressure and diabetes are due to pollutants. And so I do try to tell them that it could be due to the environment. And I have seen patients kind of go, oh, okay. Because a lot of our patients, you know, are like, I exercise, I eat healthy, and yet I can't lose weight. And it 100% might not be their fault. It 100% might be that they have these chemicals inside that are affecting their body's ability to metabolize fat in a way that would allow them to lose weight.
And I actually put it in your lecture, like a lot of health facts on the polymer and status. And oftentimes it's thoughtful because or you're consuming less and create less pollution. But we can a lot of regionally help with urban death. With your highly overnight, we can change our regional structure and city.
That's right.
to make it better. And all those things that help like pollution and groundwater, all that added up along with these end up making big change. Because there was like a really active color writing reading, like every town, whole city, the world, we make a lot of change in the past. So I mean, I feel like everyone here has a zero spirit and things that they can make speak on, and all keep this.
Absolutely. Absolutely. Yeah.
Yeah, so, thank you. She was just saying that we all can work in our own spheres of influence to make the changes that we can. So there's no reason to be hopeless. So thank you so much, Jane. And thank you so much for coming in. Thank you to everyone who came online. I'm going to stop the recording now. And